Good morning, girls. Today we look into the topic leukemia, which is nothing but blood cancer. Introduction. Cancer of blood forming tissue is leukemia, which hinders the body's ability to fight infection. Leukemia is nothing but cancer of blood forming tissues, including bone marrow. Many types exist, such as acute lymphoblastic leukemia, acute myeloid leukemia, and chronic lymphocytic leukemia. Symptoms. Excuse me. Now we look into the symptoms of leukemia. Leukemia symptoms vary depending on the type of leukemia. Common leukemia signs and symptoms include fever or high temperature, sometimes chill on the other end, persistent fatigue or weakness, frequent or severe infections, losing weight without trying, swollen lymph nodes or enlarged liver or spleen, easy bleeding or bruising, recurrent nosebleeds. Types of leukemia. Acute lymphocytic leukemia, which is shortly notated as ALL. This is the most common type of leukemia in young children. ALL can also occur in adults. The second type of leukemia is acute myelogenous leukemia, shortly notated as AML. AML is a common type of leukemia. It occurs in both children and adults. AML is the most common type of acute leukemia in adults. The third type is chronic lymphocytic leukemia, which is shortly notated as CLL. With CLL, the most common chronic adult leukemia, you may feel well for years without needing treatment. The fourth type, the chronic myelogenous leukemia, shortly notated as CML. This type of leukemia mainly affects adults. A person with CML may have few or no symptoms for months or years before entering a phase in which the leukemia cells grow more quickly. Other rarer types of leukemia exist, including hairy cell leukemia, myelodysplastic syndromes, and myeloproliferative disorders. Risk factors, which means who are all prone to leukemia very often or very common. Previous cancer treatment. The people who have had certain types of chemotherapy and radiation therapy for other cancers have an increased risk of developing certain types of leukemia. Second one, genetic disorders. Genetic abnormalities seem to play a role in the development of leukemia. Certain genetic disorders such as Down syndrome are associated with an increased risk of leukemia. The third one, exposure to certain chemicals. Exposure to certain chemicals such as benzene, which is found in gasoline and is used by the chemical industry, which is linked to an increased risk of some kinds of leukemia. Smoking is another crucial factor where it increases the acute myelogenous leukemia. The last one, family history of leukemia. If members of your family have been diagnosed with leukemia, your risk for the disease may be increased. Main causes of leukemia. General leukemia is thought to occur when some blood cells acquire changes or mutation in their genetic material of DNA. A cell's DNA contains the instructions that tell a cell what to do. Normally, this DNA tells the cell to grow at a set rate and to die at a set time. So, in this diagram, you can see the variation between normal cell and the cancerous cell. So some changes are occurring in normal cell, making them to become or to develop into a cancerous cell. Treatment. Chemotherapy, by which you can treat cancer patients. Radiation therapy, chemotherapy with stem cell transplant, which is a recent therapy. The fourth one is the targeted therapy, which uses drugs or other substances that attack specific cancer cells with less harm to normal cells. Thank you.